Hello, and welcome to the second edition of a cultural results review for emergency medicine specialists. Let's begin. First, we want to make sure that we are at the right hospital, so we want to click Edit Pools from our in-basket. Select your in-basket, Edit Pools, and you'll get this screen. You want to select Franklin ED Results Pool. Hit Accept, and then off to the races. We need to select a patient to review, and then do an encounter note to make sure that they were given the appropriate antibiotic, or any antibiotic for that matter. Once we click the Encounter button, we can simply go to the Results tab or the Discharge tab and look at the RX or referrals, looking to make sure that they were prescribed an appropriate antibiotic or medication. Then we can do that another way. Say we don't want to even go into the chart. We just hover here with our mouse, and it'll show us all the prescriptions that the patient is currently taking. We just look for the appropriate antibiotic that would treat the positive culture result, and then move on. Moving on, there are two scenarios to do. We need to either complete the review of the result note by saying there's no more actions required, or we need to add a prescription and ask the charge nurse to call in a script, e-prescribe a script, and then write a result note. Scenario 1. We need to review the result and add a result note. So make sure we have our patient selected. We've already checked that they've gotten the appropriate antibiotic. We just file a result note by clicking here. Get a very busy screen. We want to uncheck the route note to no recipients. Simply type in, hey, no further action is required. The culture is reviewed, patient treated with X antibiotic. File that into the chart. Select complete in-basket message so that the culture result gets out of our in-basket, and then hit accept. That's it. Scenario 2. Uh-oh, this patient has a positive culture but no prescription. What do we do? Well, we need to order a prescription and then ask the charge nurse to either call it in, or we can even easier e-scribe it and then write a result note saying we did that. So we select our patient. We've already checked, hey, this patient needs an antibiotic. We click telephone call, hit accept. And now this is where the update changed for the culture results. The telephone call has this add order button in the bottom left. Hit that, and then you're able to type in any order you want for any antibiotic. Let's choose nitrofurantoin. So we selected macrobid. Now we need to edit our macrobid prescription. We can ensure that the normal button is selected if we want to e-scribe. If we want to print it, obviously you would hit print. Trent and I talked about the phone-in method. The charge nurses have a hard time finding the prescription if you choose this option, so please do not choose the phone-in or no print or sample buttons. Simply select normal for e-scription and print if you want to actually print it and hand it to the charge nurse so that she can call the prescription into the patient. If you want to e-scribe it, once you hit and ensure that normal is selected, go back to the prescription, hit the hyperlink, the blue text for the prescription or the pharmacy, and then select whatever pharmacy the patient wishes. Obviously, you would have to call the patient or have the charge nurse call the patient and ask their preferred pharmacy. Type in the address, select it from the screen, and hit accept. Now, if the prescription says the normal button is selected and you selected the appropriate pharmacy for the patient, all you have to do, sign the orders, and it'll get e-scribed. Now we just need to tell the charge nurse that we did that. Go back to our in-basket. We reselect that patient and now do our result note again. This time for the result note, we want that route to selected. For example, we're going to tell the charge nurse we prescribed macrobid. Our route note to box is checked. We need to select a recipient, and we simply type Franklin ED charge nurse pool or Franklin ED charge. Hit enter. Type in our result here. Hey, I added a prescription to macrobid. File it in the chart by clicking this button and then hit accept. Isn't there a faster way to do this? Of course there is. We can pre-build a result note. Simply click on Manage Quick Actions by hitting this little arrow, select Result Note, and we'll get a blank result note. We just need to label it, Franklin Cultures, make sure that our Franklin ED Charge Nurse pool is selected, write whatever generic result note text we want, make sure it's filed to the chart, and then hit accept. Once we do that, we want to make sure that the result note we just created is visible to us in our in-basket. So click Manage Quick Actions. You'll get this crazy screen. Simply ensure that your Franklin ED culture or whatever result note that you just created is at the top by selecting it and then moving it up or down. Then, when you go back into your in basket here, you'll see your new result note sitting there ready to be used. That's it. Thanks, guys.